In this video, we will explain how to potentially resolve common sound quality issues to maximize the effectiveness of your electrolarynx. If your device sound is muffled, buzzy, or just doesn't sound as it used to, you may be able to resolve these issues on your own by following these tips and tricks. Having a bad phone ring can impact the sound quality of your electrolarynx. This is what a device sounds like when it is muffled or has excessive buzzing. And this is what the device should sound like. If you find that the foam ring in your electrolarynx needs to be changed, Atos Medical has a foam ring kit available. The kit includes an install card and 5 foam rings. Next, we will walk through the removal and installation of the foam ring. Once you receive the foam ring kit, remove the cap from your electrolarynx. Push your sound button through the sound head cap. Then, remove and discard the old foam ring. Before installing the new foam ring, you need to ensure the device is clean. First, clean around the inner crevice of the sound button. Then, clean around the inner crevice of the sound head cap. After you've thoroughly cleaned the device, you can now install the new foam ring using the provided install card. Slowly and evenly place the foam ring around the sound button. Ensure there are no twists in the foam ring. Once the foam ring is evenly distributed around your sound button, insert the sound button into the upper portion of the sound head cap. Here, you can see part of the foam ring is seated in the crevice. Pinch the sound button using your middle finger and thumb. Continue to hold the sound button in place while using the install card to press the foam ring into the sound head cap. The foam ring will slowly start to fit into position. Keep pressing the foam ring around the sound button until most of the foam ring is seated inside the sound head cap. Once a majority of the foam ring is seated, use your other hand to twist the sound head cap about a quarter to half turn while continuing to pinch the sound button. Now that the foam ring is properly placed into the sound head cap, place it back on the device. Test the sound of the device. If after you change the foam ring, the issue still persists, try the steps in the diaphragm section of this video, or contact Atos Medical. The diaphragm orientation can also impact sound quality of your electrolarynx. If your device sounds similar to this example, then the diaphragm may need to be realigned. To check your diaphragm orientation, remove the sound head cap assembly. Here, you will notice the diaphragm, which is a clear rubber piece that has a bump in the middle. Proper orientation would have a rod sticking through the center of the diaphragm. If the diaphragm requires adjustment, gently press around the middle of the diaphragm until it is seated around the groove in the coil post. Be sure not to push the diaphragm past the groove in the coil post. If you accidentally push it too far, gently pull the diaphragm upward until it is seated around the groove. Once you realign the diaphragm, place the sound head cap back on the device. Test the sound of the device. If the sound quality is still poor after you have adjusted the diaphragm, contact Atos Medical. We hope you have found the information and tips in this video helpful. If you need any additional support, reach out to us at Atos Medical. We're here to help. For additional resources, visit our website.